Well, broadly speaking, I think the two big areas when you talk about the intersection of health and justice internationally, but certainly in the United States, is that so many people, and I think many of your listeners probably are aware, the United States incarcerates at a higher rate than most countries in the world or in history. And a majority of the people incarcerated have unmet needs when they're in the community in two broad areas. One is unmet mental health needs, and the other is unmet needs around addiction. And as you can imagine, there's overlap between those two areas. So there's a good example of, you can deal with someone while they're in crisis, or you can maybe revive someone from an overdose in the moment. But if you're not more effectively addressing and treating the underlying diseases in the community, boy, I think you can expect there to be bad outcome from the natural history of both of those conditions. So then in a related note, a lot of the work I did over the years related to infectious diseases, which also go hand in hand to some extent with addiction, the epidemics of HIV and viral hepatitis B and C were, at least in decades prior, largely tied to shared needle use and injection drug use. So, again, these were all areas that, again, you could treat one individual patient, or you could take a step back and say, how do we, more from a public health perspective, how do we better protect? I do want to make one more health issue that's related to the mental health, but when I'm pivoting, you mentioned I also do work consulting and visiting and auditing care in immigration detention, which is really, slightly different than the correctional system for people convicted of crimes or charged with crimes. And there, you see it in both jails and prisons, but more pronounced in immigration centers, which are a little bit more like refugee camps. You see more impact of trauma on the population. So what they call trauma-informed care, which is care where not just the mental health person is sensitive to the fact that you've been traumatized, but you teach everyone who works in that facility how to be more sensitive to people who have suffered trauma. That's an example of adapting a systematic approach to working with the population, in addition to working with them one-on-one.
I see. So you notice differences between the detention centers and the prisons. I suppose that the problems facing in these two situations are not always the same. They
Correct.
reside a lot into mental health, probably not being tackled, which is also a problem of society in general, I would say. No,
yes. Yes, right.
We deal with mental health as it was something less than other kinds of practicing. No, we take more care of our bones broken, but our mental health it's the last thing that we take care of.
Absolutely.
How do you deal with mental health in environments where you are privated of freedom or movement or
Well, you really hit it right on the head. So first of all, there's usual resource constraints. Generally, all medical services, but particularly mental health services, are not as properly resourced in proportion to the need. But you've sort of touched on another important issue. The environments themselves are harmful to mental health, and there's really a rich literature on that, particularly in immigration detention, where the detention can be indefinite. One advantage, if you're convicted of a crime in the United States and you're sentenced to prison, you have a fair idea of how long you might be there, although there are adjustments for good behavior and maybe appeals for early parole, but you have a fixed idea of what you're facing. You get picked up in immigration detention, you're often in an indefinite detention situation. You don't know if you're going to be there for a week, a month, a year, 2 years, 5 years. And that creates an enormous stress on people caught up in those systems. And that's an international phenomenon, not unique to the United States.
How much of your work then it's actually working inside of these centers, like inside of prison or the institutions itself, or trying to avoid these things? Because, for example, you touched the fact of shared needles, and the addiction infections, for example. But that's something that it comes not only inside of the system of prisons or these closed systems. It happens in society in general. So how do you try to prevent that from a previous step to arriving to the penitentiary centers?
It's a great question, because another thing my colleagues in the profession have been trying to work on for years as we interface with people in government officials and public health officials, is to remind them that jails and prisons and immigration detention are not, as you might think, walled off, isolated. If you're walking around in the free world, you just don't need, if you're humanitarian good, you can care about what's going on in there, but the rest of us don't need to worry about it. It doesn't concern us. Then you don't know anything about jails, prisons, or immigration detention, because they happen to be areas of high turnover, especially jails, where you're maybe held for a matter of days before you're released to court. And as such, actually, they're a very important part, particularly in infectious disease. We and my colleagues anticipated, as COVID was developing, that the government and the public health authorities had not factored in jails, prisons, and immigration detention. They were tinderboxes of how you could effectively spread infectious diseases like COVID. And indeed, in spite of our warnings, some facilities did listen, some didn't. We basically said, you got it. You were emptying colleges. You were breaking up all sorts of congregate living settings as much as you could. You're getting people off cruise ships, but you were leaving everyone in jails and prisons. And as you know, and internationally as well as in the United States, there are a number of huge outbreaks. It spilled over into the surrounding community because people didn't realize that the jails and prisons are part of our community. And when you're looking at public health, they're actually ideal places to deliver resources to, because not only are you dealing with a high burden of disease and mental health and addiction in jails and prisons, but in addressing them, you're positively impacting the community with downstream effects that are often, in the case of infectious disease, fairly immediate.
You said a couple of times the term public health, and it's something that maybe it's from a European perspective, and maybe it's a little bit biased, no? But how does it work? Like, because normally, or what it arrives informationally wise to us, it's that the American system of health, it's rather private, so it's difficult to access even for normal people outside. It's expensive. How does it work when you are in a detention center, when you are on a prison? Who pays for that? Who is taking care? Of course, you are there. No, I suppose that's basically your role. But is it part of like I don't know, a bundle of the government saying, okay, this goes to prisons, and that includes the health of the prisoners, or is it a separate institution?
It depends on where you are. There are some health programs in jails and prisons that are run through the health departments of the state, and then more commonly, they're usually run by the jail and prison bureaucracy itself. But you did use the term healthcare system or American healthcare system. I have a colleague, an advocate, who likes to remind us whenever we use that term. He says, no, actually, the problem in the U.S. is we don't have a system at all. We have, a lot of private, parties all in the space, but there's no really organized system. But the interesting thing in the United States, not immediately relevant to immigration detention because the rights of non-citizens are different, but for jails and prisons that house U.S. citizens, there have been two major Supreme Court cases, one in 1976 and the other in 2011, that have reaffirmed the government's obligation to provide medical care for people they incarcerate under the Eighth Amendment ban on cruel and unusual punishments. So ironically, the one population in the United States that has a constitutional guarantee and access to care are people who are in jail and prison. So think about the bit of irony there. Now, does it mean they get the best of best care, or does it mean they often even get adequate care? No, but it does give lawyers and the legal profession some foundation to advocate effectively when there are gaps in healthcare. And Right now, in my own home county in Southern California in Riverside,
If you liked this short video out of the full episode, you can find the link to it around here and in the description below. Of course, if you are also interested in checking out other episodes, please subscribe and like.